The fight against tuberculosis in Cambodia is being fought in communities, not hospitals. Health workers from the government and NGOs go door to door in the most at-risk neighbourhoods. Here they make sure that SOTH takes his medication every day for 6 months until he's TB-free. If he stops, he'll die. The volunteers say they get to as many people as they can, but there are a lot who still don't get the health care they need.
Accessibility needs to continue to be improved, especially in areas where they live very far from the health centres. And that's also where maybe the knowledge about TB and awareness about TB is not so strong.
TB is treatable with antibiotics, but people are still dying. SREY 2's 43-year-old sister died 2 months ago because she didn't seek treatment in time.
When she had herself screened, she was told that she had tuberculosis, but she was already too sick. It was too late.
After decades of civil war, Cambodia's medical sector was all but destroyed. Thanks to money from the Global Fund and other donors, the government has worked with NGOs to rebuild and decentralise. It has 1,300 community health centres providing free TB services. One result is a drop in the death rate by around 67%.
Not only we have to have the good plan or policy, but we should have a good implementation.
And a lot of money. So far, the Global Fund has spent more than $40 million fighting TB in Cambodia. It's said that tuberculosis is a disease of poverty. It thrives in poor communities like this. And while Cambodia has done a good job so far of combating the disease, there is a concern that without continued funding, much of the good work could be undone. Health workers are already noticing that money is becoming harder to come by.
Because Cambodia has progressed quite substantially, so we are now a low middle income by World Bank standard. So a lot of donors are actually pulling out.
Cambodia still has one of the highest rates of tuberculosis infection in the world, but the statistics are heading in the right direction quickly. A drop-off in funding may slow them or even send them in the opposite direction. Wayne Hay, Al Jazeera, Phnom Penh.